Hi, my name is Taylor Altomare, and I'm going to be discussing the assignment for our HAP 360 class on Plan Process Improvement through Information Systems. This assignment asked us to design how genetic information can be used in the management of a depressed patient. Throughout this PowerPoint, I'm going to narrate the events the patient went through while seeking to find assistance in helping to solve their depression. We're going to call this patient Patient Z. They first contact an urgent care facility concerning their mental stability. There are 5 assumptions made. The patient has an HMO staff model. The patient has health insurance. They are already assigned to a pharmacy. The patient is suffering from an unidentified form of depression. And the patient is aware of their past history with depression and can state previous medications used. During the patient's first call to the urgent care facility, this information will be needed: the patient's name, their date of birth, the reason for the call, and their insurance information. During patient Z's first visit to the urgent care facility, their vitals will be first taken by a nurse. They will then be examined by the doctor. They will review the information with the doctor, and the symptoms will be discussed with patient Z. And the doctor will hopefully be able to diagnose the patient, and an initial medication will be prescribed. The urgent care facility will most likely send patient Z to their primary care physician. Here, the following information will be needed: the patient's demographics, signs and symptoms, insurance information, the patient's history and mental health records, and detailed notes of any medical or mental health changes. In this first visit, the physician evaluates the patient's condition. He prescribes him an antidepressant medication and suggests a follow-up within a week. The pharmacy the patient belongs to receives the prescription, and the patient is given the medicine within a day. However, during the follow-up, the patient's condition remains neutral even with the new antidepressant. The doctor performs an assessment, and the primary care physician recommends him to a psychiatrist. He fills out a referral, and patient Z schedules an appointment the next day. During the patient's first visit to the psychiatrist, the following information will be needed: the patient's demographics, their reason for the referral, their signs and symptoms, past social and medical history, insurance information, and any family history of mental or emotional illnesses. To help better understand patient Z's form of depression, the psychiatrist asks for consent to order genetic testing. Patient Z agrees, and a DNA kit is ordered from a lab. For the time being, the patient is sent home and prescribed to another antidepressant medication. Once the DNA has arrived at the practice, the patient will be asked to come in. A sample of saliva is taken from the patient, and then the kit is sent back to the lab. The patient will continue the same treatment until the results come back in. While both the psychiatrist and patient Z are waiting on the results from the lab, the psychiatrist continues to monitor patient Z's condition, and the initial treatment is continued. A follow-up appointment is scheduled in 4 weeks. Within 8 weeks from the first visit, the psychiatrist gets the genetic results back in from the lab. Patient Z's electronic health record is updated with the new DNA information. This information will help the doctor, and it will reveal the severity, kind, and type of depression patient Z is suffering from. Patient Z is now prescribed another medication, which is sent to the pharmacy. A final follow-up is scheduled. The treatment based on this genetic information seems to be working for patient Z. The original symptoms have significantly decreased, thus leading patient Z to live a more manageable lifestyle. Multiple actors exchanged information regarding patient Z's electronic health record. However, the genetic testing lab and the psychiatrist were the ones that did most so. In short, this process helped us attain the following information: when and what information was needed for patient Z's electronic health record, and how genetic information can manage the treatment of an individual depressed patient. I hope this PowerPoint was useful and it will help assist you in our next assignment.